I'd like to welcome all of you to the Many Faces of Colon Cancer. My name is Margaret Stauffer, and I'm going to be the MC this evening. We are so pleased to have a great panel of physicians and dietitian who are going to present a lot of information. We are so pleased tonight that DVO has organized this wonderful program, and we are having some great speakers. Dr. Saeed Zamani, who's a gastroenterologist with the Center for Gastrointestinal Disorders in Walnut Creek. And Dr. Zamani is going to be speaking first. He's going to talk about cancer prevention and screening. And you'll notice in your program that there are some blank cards. And if you have a question for Dr. Zamani, you'll notice that there's a blue card where you write down questions for him. So without any further ado, Dr. Zamani, welcome.
Hello, everybody. Thank you very much for sharing your time tonight with us, and I would like to appreciate Diablo Valley Oncology and Cancer Support Community to invite me for this informational talk. So as you heard, I'm a gastroenterologist. My job is to either prevent or diagnose colon cancer, and basically I see two teams here tonight. The first team is me and Ms. Chiu, and basically we are P team, team P, letter P I mean. We prevent colon cancer. And then we have team T, or therapeutic team, that they treat colon cancer. So obviously with your support, and after this talk, we are hoping to make them out of commission and to prevent all colon cancers. So I have only 10-15 minutes to go over how to prevent colon cancer. I really need 2-3 hours to talk on this important topic. So I just try to give you some highlights regarding prevention of colon cancer, and hopefully we will cover more questions and answers in QA sessions. So without hesitation, let me go over some important issues on this topic. So let me ask you a funny, tentative, strange question. So if you have 2 hours of free time, what do you do? Shopping? How many women we have here? I know your answer. You read a book, you watch a movie, you go to a coffee shop, drink coffee and do internal search, or you go for a colonoscopy. Of course, my answer is different than yours, but let's see if I can change your mind. So, let me see if I have it. So basically, this is the lights. So basically, this is a brief description of gastrointestinal tract. We have esophagus, stomach, 20 feet of small intestine, 4 to 5 feet of colon or large intestine, and the last part is called rectum, and obviously we have other organs like liver, gallbladder, and pancreas. So the last part which we are going to discuss is the colon. And what is the function of the colon? Basically, it absorbs water and electrolytes. Your food, or our food, will be absorbed in a small intestine, but colon absorbs water and electrolytes. And obviously, rectum stores waste material. Now, what are the diseases of the colon? Colon may get inflamed, we call it colitis. It may have infections like E. coli, Salmonella, Shigella, these type of things. Many of you have heard diverticulosis and diverticulitis. We are not going to cover these topics today. Irritable bowel syndrome, poor circulation to the colon, we call it ischemic colitis. Obstruction of the colon, but the main thing we are going to focus today is colon cancers and polyps. So, is it important? Is it worth it to spend time and to talk about this topic? And look at these statistics. The answer is absolutely yes. So colon cancer is colon cancer obviously is the cancer of colon or rectum, and the incidence is approximately 150,000 cases per year. So approximately 50 to 60,000 people die every year because of colon cancer, and I hope Dr. Joel will agree with me that this is the second most killing cancer in this country. Or in fact, 500,000 people die in the world every year because of colon cancer, and we can prevent it. obviously is equal in both men and women. And 5% of people after age 50 develop colon cancer. That's why age 50 is so important and has become a landmark. You are 50, you need to check your colon for colon polyps. So majority of colon cancers start with a colon polyp. This is very important. I want you to take home this, take this home, this message to home. Basically, colon cancers, majority of colon cancers start with colon polyp. This is very important. That means if we can find and remove colon polyps, then we can prevent majority of colon cancers. So, colon cancer happens in 5% of cases. How about colon polyps? I mean, statistics show that 15 to 25% of people after age 50 have colon polyps. Do they know that? No, they don't, because colon polyps do not cause any symptom, but they are growing slowly, gradually, and eventually transform to colon cancer. So these are some examples. So this is the lumen of the colon. This is called the colon polyp, another colon polyp, different type of colon polyp. So there are different shapes of colon polyps. They can be something around 2-3 millimeter to 30 millimeter or 3 centimeter. So these are the things that we are dealing every day, and these are the questions people ask us. Can we prevent colorectal cancer? What's your answer? Yes. So how can we prevent colon cancer? I told you that one of the most important factors to promote colon cancer is age. Can we modify our age? No, it is what it is. How about modifying family history? If your father or sister had colon cancer, can we change it? No, we can't. It is what it is. How about modify risk factors? Okay, I mean, obviously we will hear from our colleagues that depending on what you eat, the environmental factors, geographic area, some people may be more prone to develop colon cancer. That's why United States is one of the most common places to have colon cancer. So can we modify those risk factors to some extent? Yes. And eventually, how about to find precancerous lesions? What's the name of that precancerous lesion? Colon polyps, exactly. So we have two categories of people or patients that may develop colon cancer. One group is called average risk patients. Means everybody after age 50 with no family history of colon cancer or polyp. So 5% of people after age 50 develop colon cancer. Big number. But there are some people that even are more predisposed to develop colon cancer, and those are people with family history of colon cancer, family history of colon polyp, personal history of colon polyp or cancer, and eventually there are some diseases like ulcerative colitis that in long term can predispose people to develop colon cancer. So, common questions. Some people ask, I just turned 50. I'm healthy. Should I be tested for colon polyps? The answer is yes. I don't have any family history of colon cancer. Should I still be tested? If you are after age 50, yes. Or if you have some symptoms, yes. I'm a high-risk patient for colon cancer. Should I be tested at younger age instead of 50? The answer is yes. In fact, we will review that if somebody has family history of colon cancer in a first-degree relative, instead of age 50, we have to start at age 40. And I don't know which test is appropriate for me. Will you perform the test? Usually, yes. Gastroenterologist will discuss with you and decide with you which test would be the best option for you. So who should be screened? Now you're expert in colon cancer prevention already, I expect. How to screen those patients? So, if somebody is age 50, is called average risk, needs to check the colon at age 50 and then every 10 years. These are very confusing numbers. I know that you will hear different numbers from different physicians, but these are guidelines. How about high-risk patients? Those with family history of colon cancer. We start at age 40 and then every 5 years. People with family history of colon polyp, the same thing, age 40 and then every 5 years. How about if you had personal history of colon polyp? Again, you continue doing every 5 years, depending on the type of the polyp detected before. And patients with ulcerative colitis, they need to check the colon every 1 to 2 years after having the disease for 8 to 15 years. Now, there is a subgroup of people with colon cancer, Lynch syndrome. I'm not going to details, but we start in their 20s, and every 1 to 2 years, they are extremely at risk of developing colon cancer. There is a rare disease, familial adenomatosis polyposis, that they don't need a screening. The colon should be removed because the likelihood of developing colon cancer by age 40 is approximately 100%. So, how to screen? Again, I'm a gastroenterologist, you know my answer. So what are the options to screen for colon cancer? Fecal occult blood test or fecal immunochemical test. Basically, a stool test detecting evidence of hidden blood or occult blood. So it can be positive, but you may not have colon cancer. It can be negative, but still you may have colon cancer. It's better than nothing, but obviously is not the best test. How about barium enema? Barium enema is X-ray of the colon. Basically, radiologists put contrast into the colon and take pictures. The problem is that the accuracy to find polyps is around 50 to 60%. And in addition, those polyps cannot be removed. So it's not the best option for sure. You have heard this name of virtual colonoscopy. We call it CT colonography. Basically, they clean the colon, they do a CAT scan, they enhance images to find polyps. Maybe can find 70-75% of polyps. Again, the drawback is that cannot remove those polyps, and there is no sedation. Flexible sigmoidoscopy was a state-of-the-art 10-15 years ago. We were so excited. Now it's obsolete because it can detect or find only 30% of the colon. Colonoscopy obviously is a technique that can detect the whole colon, and the big advantage is that can remove those polyps at the same time. Other modalities emerging basically is immunofecal occult blood test, newer versions. Detection of DNA in the stool is going to be a very important technique to detect colon cancer. Video capsule endoscopy is currently evaluating a small intestine, is a camera capsule that can detect lesions in the colon. It is in an investigational phase. And let me tell you a few words regarding sigmoidoscopy and colonoscopy. So this is the colon, rectum, sigmoid area, descending colon, transverse colon, ascending colon. So sigmoidoscopy means to go and look at this part of the colon. So as you see, can see only 1/3 of the colon. It's better than nothing, but obviously is not the best strategy. How about colonoscopy? Colonoscopy is similar equipment, but basically can detect the whole colon. And concept of colonoscopy is that patients come to endoscopy center. They will be there for 2 hours. Remember those 2 hours? They will be there for 2 hours. They will be sedated. And then we check the colon. If there would be any polyp, will be removed. Yes, there are complications involved. Less than 2 per 1,000 cases may develop complications like bleeding and perforation. And we have to clean the colon. And I'm sure you have questions regarding colon cleaning that we will discuss in Q&A session. So this is a patient that had colon polyp, never came for colon check, and obviously has developed colon cancer. This is another advanced colon cancer that Dr. Kim is dealing with that all the time. Another patient with colon cancer. This is an obstructive lesion, and obviously we diagnose all these cases by taking biopsies and confirm the diagnosis. So these are the things that, again, we are dealing with all the time. Many people say that there is nothing I can do to prevent colon cancer. The reality is that colon cancer can be prevented. Or colon cancer is usually fatal. This is a concept like pancreatic cancer. The reality is that colorectal cancer is usually curable if detected early. Colorectal cancer is a disease of older white men. This is something that some people believe, and obviously that's wrong. An equal number of men and women get colon cancer. And screening tests are necessary only for individuals who have symptoms. The reality is that 75% of all new cases of colon cancer occur in individuals with no symptom or risk factor. So, back to first question. If you have 2 hours of your time, 2 hours of free time, what do? You can answer to yourself. I know what I do.